Well, thanks everybody for joining the call today. Just to kind of set up what we were thinking and wanted to accomplish, I'll move to the next slide I have up here. So it's been a while since we went over contract deliverables intentionally with everyone. So we wanted to, we tweaked some things in the most recent round of contracts, go back, review it, clarify any changes in the contract and the conditions and assurances, and then as well as record this webinar so that when you have staffing changes or you want to share this with, your leadership or other folks at your site that need to be in the know on what the MCV contract deliverables are, you can share this with them. So that's kind of the plan for today. We're not gonna cover every single item in the contract. What we're gonna do is touch on some of the most important ones, and then some of the legal stuff. If you have any questions about it, you can feel free to contact us afterwards. But if you have questions about the stuff we're going over, please feel free to stop us and ask questions. And then we'll also do questions at the end, and you can feel free to contact us in the future as well. If as you are reviewing at your level, you find anything else that you're unclear about. So I attached a template to the calendar invite right before we started this off. So if you want to refer to that, you can. I'm also going to pull up that template on the screen for you as well. So obviously, y'all are the funded subrecipients in South Carolina for the provision of evidence-based home visiting service delivery. So under Scope of Services, some of the very first things that we want to go over are, this section right here dictates what program model you use. So that's something that hasn't been written out in contracts in the past, but we are putting that in moving forward, the exact program model that you will use to serve families. As well as this next section is the counties that y'all serve. So there's sometimes this changes, but we want to make sure that we have it on record in the contract, just where you aim to serve clients as far as your county coverage. And we use this to update the website and all sorts of stuff so that all of our communication is consistent when we're talking about your coverage area. So please make sure as you look through this year's contract that this is accurate. Then capacity of families with the funds. This is the number that we expect y'all to serve, that you've agreed to and kind of worked with us to develop what that realistic number is. So that's where we have it listed in the contract. That is the number from which we do our monitoring, and we'll talk a little bit more about that in a second. So getting more into the scope of services here. All right. The very first one, it's straightforward. We just ask that one person be kind of the official contact at your site so that we have one person to kind of communicate with. Some sites, obviously, you have one or two, and that's fine, but so we're in good standing there. But just know that if someone's not copied on something, clarify with us who needs to be the point person at your site, and then that person is responsible for forwarding anything that needs to be shared with other folks. The second one, agree to implement home visiting services with fidelity to the specified program models in use. Y'all are pretty used to this by now, but we want to reiterate that today on this call as well. And then moving into the next deliverable, it goes into more detail on what we expect with fidelity. So we expect, as a MCV site, that you will strive towards the highest quality standards as defined by the models in use. So that means national model developer requirements, as well as striving for and maintaining accreditation, affiliation, whatever your model has as sort of the highest standing. And any applicable MCV standards and provisions, so obviously with that. So I wanted to also, for the Healthy Step sites on the line, obviously this is, do you guys have a question? Okay. All right, so for the Healthy Steps on the line as well, just wanted to touch on the fact that your leadership really needs to be aware of, obviously, all the changes with Fidelity and moving forward. And if you have any issues at your level communicating that, just know that this is in the contract where it says, why part of the requirements are listed in the things that we send out, and then part of what you're held to, obviously, are model standards and requirements. So this just kind of reiterates that. Okay, good. So the next one will ensure that participation of families in the program services is voluntary. And I wanted to go over this one specifically. It seems pretty straightforward, but I tell you, we have issues every now and then with folks and some of their referral sources. This is not a treatment plan that is mandated for any of the folks enrolled in MCV. It may be for other programs, but these are voluntary services under these funds. So just want to reiterate that. So this next one, you will agree to maintain a service delivery to at least 85% of the capacity of family slots identified above at any given time during the project period. So obviously, I've kind of verbally been telling sites about this over the years, but just want to reiterate, 85% is the percentage by which we monitor sort of where you are with enrollment. So the number that is listed on page 1 of the contract is how we look at where you are at any given time during the year or project period. And so if that ever needs to be amended, you need to let us know and have justification.
Hey, Kathy, I have a question about this. This is Sarah from the Peds Clinic. So, right now, I only have one parents of teacher educator, and she actually, I think, has 7 kids signed up, which is not anywhere near close to our 85 percentile rate yet, because my supervisor is starting November 3rd. She's getting training this week. So, I mean, do y'all kind of take that into consideration with loss of staff and people moving around and stuff and starting a new program?
Yes, of course. With definitely program startup, we do. So obviously the first month you won't be held at 85%, but it is a way for us to have some standard, if it's, a month in and you're still at 3 clients.
Sure.
And you're not moving towards the 85%, then that's when we say, well, 85% is the number by which we have to, so that's kind of an explanation of, but I totally hear you. And with Healthy Step sites, the new folks that are, not new folks, the folks that are implementing new program models, obviously you're at the beginning of getting to that point.
Thank you.
You're welcome. All right, so the next one, we'll agree to participate in ongoing continuous quality improvement CQI efforts at the state and local level to better assess the needs of families served, strengthen quality of service provision, and increase the retention rate of participants and staff. So this is, more than just saying the learning collaborative participation is required. It is, but this deliverable goes beyond that. We expect that continuous quality improvement is something that is necessary in the field to make sure that you are continuously serving families better and offering them really what they need so that you get those outcomes and the quality. Yes? Someone say something? Okay. So sometimes there's confusion on this one, but as a concept, we require the continuous quality improvement at your local level as well as the state level when we convene things like the learning collaborative and things like that. So I just wanted to clarify that, that deliverable there. All right. This next one, update information. We ask you to provide us with updated information on the site for any positions supported by these funds no less than quarterly or upon request. So this particular one, I know sometimes we have difficulties keeping the monthly check-in calls with all the sites, but this is essentially one of the things that we ask for under this deliverable is we want to be kept up to date on what's going on with with things at the site, with positions that are supported by the funds. So no less than quarterly, obviously, but we are asking kind of for a monthly check-in call with each site just to keep us updated on everything. So I'm kind of relating this back to what we've been doing. So that's that deliverable there. As well as that, going a little bit deeper into detail, we ask that you agree to notify us of any staffing changes to funded positions within 72 hours of receiving something like a resignation notice or termination notice and or start date of new hires. So specifically with staffing, we want a little bit more quicker turnaround on those notices. And everyone's pretty good about that, but every once in a while we have sort of a delay in hearing about something, and we do staffing reports for HRSA that are timely or not timely, but time sensitive. So that's why we have this in there as well. All right, let's see. This next one, y'all are really good about, but keep safety identities of your clients and comply with everything under HIPAA, essentially. I also want to note here, let me make sure I have. So please, it sounds silly to say, but please make sure never to send us client information, and that's as simple as names. So when you submit RFPs on your travel documentation, please make sure that nothing on those documents or documentation mentions family-specific information. So just a reiteration there, identifiable, yeah. And then as well in some of the data reports that you submit to Iceland, she's been reminding sites on calls as well. You know, in any of the benchmark data that goes directly to her and not through the McPhee system, that needs to remain de-identified when it's sent. So just a reminder there, but we're usually pretty good about that stuff. Okay. All right, the next one. We'll agree to collect any additional level data and research components as required by the McPhee legislative benchmarks, HRSA, or the Children's Trust as designated by the evaluation team, specifically related to any positions supported by these funds. So this one, just so you know, is obviously y'all are required to collect data and enter that into the system, but as well other things occur throughout the year with the evaluation team, and we ask that you participate in things like the social network analysis, so when you get emails about that, and sending out surveys to your partners. This is where we in the contract make sure that we're asking this up front and that you're aware that this is a deliverable. So just wanted to review that. And then things like focus groups as well, when we ask for y'all to participate in those kinds of activities. This is where in the contract that is stated. All right, so I'm going to turn it over to Amber for the next couple of deliverables. Does anybody have any questions or comments on the things I've shared so far?
Hey, this is Sarah again. It might cover in the future down the road, but what about like our Healthy Steps contracts and paperwork? What is the required time to keep those files for record keeping?
We're going to get to that in one of the later deliverables, Sarah.
Okay, thanks.
Hey, Kathy, I have a question. This is Alina.
Sure.
On the front end, as far as our the McPhee site lists nurse-family partnership, and then we had in the beginning of our contract we had the 3 counties, and then through the Pay for Success expansion, we expanded to Lawrence County, which is not listed. Do we need to do amendment on that to add Lawrence County to the contract?
Yeah, if they're McPhee funds that are being used to serve those families in that county, then yes. Okay.
Because it was, you know, added on in the middle through this whole process that I know McPhee is supporting the Pay for Success initiative too.
Yeah.
Okay.
Yeah, and you know, I want to say, if the contract is already in place for this year, we can just, if you just include that in your progress report, we can make a note of and document it that way. So that will be sufficient, I think, for this year.
Okay. Or an addendum, or
Have you
So
executed, the contract been executed on your end yet, signed?
No.
Okay. Because in the past, we've been okay with you, if someone wants to write in that county, in that scope of services and just.
Well, actually, I'm sorry. I'm sorry. I said that prematurely. Actually, we did on the 10th of October. So it has been. And
Oh, it has been?
Okay.
Okay.
Yeah.
So we can look at doing an addendum to that if need be, but we'll let you know if we need any further documentation with it.
Okay, thanks.
All right. Other questions? All right. Well, in that case, I will move us forward. So the next deliverable we're going to talk about is the next one on the page. So we will agree to workforce development adherences provided by the Children's Trust, the South Carolina Home Visiting Consortium, and other early childhood care partners, up to 4 required trainings annually for any position supported by these funds. So as you guys know and have hopefully already participated in, the All Sites Retreat, which this year will be called the All Sites Assembly, performance measures workshops, and some of the other things we do. So each year is a little bit different, but those two are definitely staple events and trainings that we would expect all McPhee funded staff members to be a part of as part of this contract. All right, the next one is providing reflective supervision and reflective practice methods to all funded staff carrying a caseload in accordance with program model requirements. All of our NFP as well, I believe, all of our home visiting models are really pushing reflective supervision. At the HRSA level, they are pushing us to monitor for reflective supervision. So this is something that we will be asking about in our check-in calls when we do site visits. We may ask for documentation in the future. We're not sure yet, but you want to make sure that you are implementing this part as part of your model fidelity and as well as part of the contract for the McPhee funding. You, as an SC McPhee site, will agree to a minimum of 2 site visits from Children's Trust, SC McPhee team, and or HRSA staff annually. These visits will include, but will not necessarily be limited to, fiscal, program, process, outcome, and data review, specifically related to any position supported by these funds. So, as you know, we will do our best to come out and visit each and every one of you and see your smiling faces in your hometown, meet you where you are. We enjoy that, and we hope you enjoy it as well. All right, next one. This one's a little bit new, so pay attention. I'm going to read it for you because it's real fun. All right, this McPhee site will be responsible for the development or coordination of regular meetings, more frequent than every 6 months, with an established early childhood care collaborative coalition, apart from, aka different than, your program advisory committee, which is demanded by your model fidelity, within the catchment area to target efforts that include home visiting, specifically related to the activities of the agency and program model. The members of the Early Childhood Care Collaborative Coalition, you can definitely change the name of it, can participate on the Program Advisory Committee. All right, what this says, most of you are already doing this, but you need to be a part of a coalition, a collaboration, a cozy, whatever you want to call it. You need to be a part of one of those. They need to be meeting regularly. You can't meet every 6 months or once a year and consider that your community outreach and your community engagement. That's not going to work. What we really want to see is every month, every other month, that you're meeting with other agencies that are doing similar work to you. Maybe they're doing really different work, but you're all focused on building this system around early childhood care. So as I said, most of you guys are already doing this, but we are definitely going to be asking a lot more moving forward, especially for our sites that are doing new programs. It's really important to keep up those partnerships, relationships, and continue developing them. And again, as it says in this specific deliverable, this is different from your program advisory committee or your CAB. That's something you'll create, and that should, I think, in most cases, meet every 6 months or 2 or 3 times a year. That's going to be different. You might have the same people, you might work some of those partnerships, but that program advisory committee is focused on your program specifically. The Early Childhood Care Collaborative Coalition, whatever words you want to use,
that is more focused on the community, what services are available, how do you fit in the bigger picture, and what can be done to leverage services between agencies. So any questions about that, as that's a little bit new, a little bit change up there?
Yes. This is Alina. Hi, I just have a quick question on that. With these, partnerships and different committees and some of our collaborative partners, if we need training and we have room or funding within our budget, are we allowed to bring along a collaborative partner with the same focus as, say, for instance, nurse-family partnership or early child development? Is that allowable here? I know in the past, and I'm dealing with Missouri laws, we could bring, one of our partners along to learn in some of the, collaboratives, so they'd be best to serve and more have a synergistic effect when we're meeting together. So is that something that can be done?
I think, Elena, this is Deb. It's going to depend on what the event is and the purpose. So I don't think there's a blanket answer for that. I think that's something that you would have to request, in advance to see if we could approve the funding of that, because there would be different issues we would need to consider for that.
Okay, thanks.
And that is a great way to help develop some of those partnerships and build that synergy. I like that word a lot. So good idea. But yeah.
Right. Yeah, I was going to use like 0 to 3, for example, and we have a lot of programs that can use that model, but they may not be able to have the resources. Say, for instance, it wasn't the registration, $300, so they're getting there, and you're supplying through partnership the registration fee with that coming under your program. That's something like that is what I'm getting at.
Yeah, that's just hard. HRSA wants us to collaborate and, like we said, explicitly have local coalitions that you participate on and have really good relationships with, other entities, other stakeholders locally. But then they really don't like it when we say, well, can we pay for X person to go here or to go to this training? Like they're like, oh, it's not directly someone funded by the grant. No. So kind of like Deb said, we can look at that kind of thing on a case-by-case basis going forward. But that's kind of the answer we always get, even with us. Yeah.
Hey, this is Sarah again. So just make sure I got this straight. So once I get all my peeps together and we're all ready to go, or even before that, the supervisor and the educator should develop a system where they go out at least once a month and identify a local agency or another like PASOs or Reach Out and Read, where they meet with each other monthly and then somehow document, the collaborative relationship or what they've talked about or what resources they shared, kind of something like that.
Sarah, that sounds amazing. No, you do not have to put in all that effort. Okay, so really what we're looking for, I know a lot of communities already have meetings where the local PAT program or the local First Steps office, they get together and they just invite, it's more of a community meeting for those agencies that are serving children, get together. That counts. What we want to make sure is that you guys are not just sitting in your office running your own program, but that whether it is just your supervisor or it is one parent educator or you guys they take turns attending those community meetings, getting out there, talking about what you're doing, who you're serving, and then also learning the community resources. I would feel in your area there probably is a lot, or I would hope there's at least something going on. So you don't have to create any of these meetings. If there's something already going on, you just need to participate and be out there. In the case that you're in a community where there isn't any sort of meeting about, making children's lives better, serving the community, that's where we would expect you as a McVie site to really use your funds and leverage into creating some sort of systems are like a really big word, but a group that gets together and talks about it and has a meeting, whether it's monthly or bi-monthly. So yeah, if there's nothing that you can find, then yeah, we definitely want you guys to take the initiative, and you can, in those monthly calls, tell us like, hey, there's nothing here. We're gonna have to make our own. Cool, let's talk about it. Let's figure out how we would do that. But if there's something already going on, reach out in the community, find it, and then and join them in what they're doing.
Oh, kind of like the Alonzia, how they have their monthly meeting like the second Wednesday every month at lunchtime.
Yeah, that sounds
okay.
Great.
This is Clarissa. Like we meet with United Way safety net meeting. My question is, do we need to bring a copy of their roster to prove that we're part of that group?
Not necessarily a roster, but if you keep the agenda, I know that's gonna be frustrating, but kind of maybe if you guys have a community collaboration folder or something, and just have an agenda that hopefully you sat through the meeting. You're not just picking up an agenda and walking out like in church.
Yeah.
But that's, you don't necessarily have a roster, but when we do these calls, we always ask, what are you guys doing for community collaboration? When you do your progress report, you'll also fill out about those community collaborations. So we hope that you'd be able to name off, United Way and some of the other partners that are at those meetings. So documentation is not to say that we don't believe you. It's more just if when HRSA comes back and says, hey, we want to know what's going on, we say, yeah, they're doing this. They've been telling us in calls. They've got a copy of the agenda. That just really helps to bolster the work we're doing and in the end, helping to improve those services to kids because you guys know who's in the community and you're well aware and well connected.
Okay.
This is Vicki. I have a question. Well, so if we have a member of the team who participates on one of the local county First Steps advisory boards, would that count if that person is a member of the team but not the person funded, McBee funded?
You read my mind.
Yes, that is great. That works.
That works? Okay.
Yes, ma'am.
Okay. Thank you.
These are great questions.
Mm-hmm.
All right, cool. So I'm going to go to the next one, which kind of builds off of that. So this McBee site will exhibit efforts to prevent the duplication of services with other home visiting service providers in the catchment area. So again, if applicable, if you are the only NFP for miles around, you're not going to have to worry about this too much. But if you are a new PAT site in the world of PAT land, then this might be more of an issue for you. And this is going to turn up in your referral process. You're going to see some of this issue coming up. So what we really want to do, which is part of why we require this collaboration, is so that, again, you're aware of who else is doing the same program, aware of their eligibility, and really trying to partner to make sure that all kids and families are being served. We want to make sure we're not stepping on toes. We really want to make sure that we're getting those services out there and meeting families where they are as much as possible. So we'll, again, be asking these questions, and we already have an idea of some of the sites that are in areas with other programs, running the same program. So we'll definitely be asking you follow-up questions about that. Have you met with them? Do you know their eligibility? How does that fit with your program and your eligibility? So that's really what that is. It just fits right in with the collaboration. Is, again, we really want to pressure you guys to be out there talking to the other programs, make sure you understand your space, they understand your space, and that we're working together and not against each other.
Hey, this is Alicia. Can you hear me?
Yes, ma'am.
Okay, I had my phone on mute and didn't realize it. I wanted to say on the last one, if it helps for anybody on the phone, that we have a collaborative every month. And so I don't know if that can count towards that particular requirement.
Yes, that is awesome. Great advertisement.
Where are you again, Alicia?
At a Child's Haven in Greenville.
Oh, okay. That'll be a good trip.
We're on board, Alicia.
Cool. All right, now I'm going to hand the mic over to Eric.
Yeah, before I jump in, the last thing I wanted to say about Amber's last bullet there is that we also want to make sure that we're not doing, when we talk about duplication of services, that we're also not dual enrolling clients and programs. So that's one of the reasons we have that requirement there, especially two McBee programs, that we're not seeing the same families being, because it's counterintuitive to have it, enrolled into two home visiting programs being funded by the same initiative. So, so we try to be very cognitive of that. So the next few bullets were given to me. They're the really boring ones. So, so we'll get through them pretty quickly, though. So basically, this next bullet, the McBee site will furnish Children's Trust with drafts of any public documents printed with funds and disseminated on behalf of the site for comment to Children's Trust. Again, really that speaks to the fact, I'm not going to read through the whole thing because it goes into speaking about the disclaimer as well. But any brochures, any event materials, etc., that you may publish using McBee funds need to, one, have this disclaimer on there with your new contract, CFDA, and grant number, and within that disclaimer. So we just want to reiterate that. That's been in your contracts before. Nothing big and no big changes there. The next bullet speaks to the site shall furnish Children's Trust with a copy of any proposed publication 30 days in advance of the proposed publication date. Children's Trust may request the site to delay publication for a maximum of an additional 60 days in order to pursue a patent on any invention described in the manuscript. No delay, however, will be imposed on the filing of any student thesis or dissertation. And basically that is just saying that if you're doing any publications around research materials or looking to produce a product, which really it's not applicable to us, but we have to have it in there, that we would need copies of what that plan is and what that publication would be. If you're publishing any research materials with McBee data, we would need to vet that as well. So we ask for that.
It might come about if they had a grad student interning with them. So
You good? Okay.
Yeah.
Next bullet, the site will notify members of South Carolina legislator that this site, based on the county and in writing upon receipt of Children's Trust grant award, will let the legislators know about the grant award contract that we are funding. We're asking that you contact your state and U.S. representatives of any new funding. We just had this conversation internally over the last few days. We have a template that we can provide to you for that to send to your legislators. And basically, we used to do it with just our new, once the site came on board at the beginning of the initiative. We're looking to do it more annually now. So legislators, now that we're moving into reauthorization and things of that nature, and looking to expand home visiting in the state and how we can get better support from our legislators, who would like them to know more and hear from the voice of those that are actually doing the service for business. So that's why we have that requirement in there. We will send that template out to everyone. So we please ask that you provide that. We'll talk a little bit more about that and the conditions and insurances in a few minutes. Next bullet speaks to the site will promote and publicize Child Abuse Prevention Month and a checkout program for Children's Trust for taxpayers to donate to Children's Trust through their individual income tax returns. All right, let me delve into this one real quickly. We do ask that you promote and publicize Child Abuse Prevention Month. It's a big initiative for us, and we have partnered with many of you in the past to help publicize that. The checkout program requirement here. This is not a mandate in that your agency, if you already are part of the checkout program or your agency is a big corporation that is not allowed to be a part of the checkout program, this will not apply to you. However, if you have the feasibility to promote the checkout program for Children's Trust, we ask that you do. So we will not hold you to the letter of the law with that one. Again, if your agency is eligible to be a part of the annual checkout program in the tax taxpayer donation, please do as your agency guidelines allow you to do. And again, we do not hold you to the letter of law with that one. Our next bullet, the site will work with Children's Trust to coordinate a check presentation of the grant award. This is a new one that we had in there, that we have in our contracts. We may not be doing this with every site, but we may reach out to your site to have a photo op or opportunity to look at how we are better partnering with the local entities and and ask if we could set up a time to come to your site and do a check presentation, ask some of your leadership at the site to participate in that moving forward. Again, we more than likely won't be doing it with all sites, but you may be asked to do that. I'm going to skip a couple of bullets here. Okay. They're kind of self-explanatory there. We're going to jump down to the last bullet on page 3. The MCB site will meet all applicable state and federal requirements, including but not limited to the following, So again, I'm not going to read all that. A lot of federal jargon there, but it basically says that you'll have a drug-free workplace. You won't violate fraud, waste, and abuse as far as your funding and materials. You apply to the Americans with Disabilities Act, things of that nature, as written in OMB Circular A131 or 133. Excuse me. The last part of that on that page, I do want to stress, though, no funds will be used for lobbying purposes. That is a big no-no with federal funds. Make sure that we are not paying for lobbyists or any lobbying materials as far as the MCB funds are concerned. You can pay for educational materials, but they cannot be used for lobbying purposes to have a direct ask for funding or legislative change. And I think that's all I have for now. We'll get back to me in a minute. Any questions about those bullets that I just went through? I will take that as a no, and I will pass it to Ms. Deb Worden.
Okay, the next one just says we'll submit the name, address, and budget information for sub-award to be paid using funds of Children's Trust for prior review and comment. When your budget that you submit to us, you should have put if you're going to plan for subcontracts and that person there. And as with any budget changes, if you add something that wasn't already in the budget, then we just ask you to notify us. And basically about where it talks about the state agencies and the procurement, what we really want you to do is make sure you follow your own procurement guidelines. Some of the state stuff has changed, and we probably need to actually take the reference to that website out of there. But what we really want you to do is when you do have subcontracts and things like that, you follow your organization's procurement guidelines. Okay, time of performance, I mean, that's nothing really need to be said about that. That's just your contract period. Compensation, you each have your amount in the budget period, the timeline there. And I guess what this is, again, it asks for, you've already given us a budget and we've approved that. This is if you have significant changes to your budget to notify us. You can just send us an email saying that you're going to have a budget change, and depending on the amount of the budget change and what it's for, we may have you redo a budget. But it's just important for us to know that you have it, because we do compare your request for payment against the budget that you submitted. So, and as you all know, Mackenzie's going to catch it if you do something wrong. So, let's see. Then method of payment. You all have your request for payment forms that we ask you to submit to us, and we ask for you to submit those monthly or at least quarterly. And the reasons are behind that is that we have to report to the federal government, how all the money is being spent, and if we get behind on our money, then they ask us questions, and so it's just a way for us to help monitor your budget and for you to look at your budget. So that's why we ask to have that done. This contract does say by the 15th of the month, which, again, that's a recommendation. We would like it if you can do that, but I know sometimes that's not always possible. So if you could at least get it in within 30 days of the time frame that you're doing, like if you're doing it on a monthly basis, if you will have it to us by the end of the month following your request for payment. And if it's quarterly, the same thing, within 30 days from the year-end period. That will make us very happy. I mean, if you can do the 15th, the great. Sooner the better, you get your money. But we will not hold you to the 15th of the month there. So any questions on any of that? Okay, Kathy, you're up on the last of the.
Yeah, so the second half of this deliverable right here, if at least 50% of the award amount has not been expensed to the completion of the first half of the budget period, so by around April 30th of 2018, then y'all need to submit a plan to us using our form, which you'll get if you run into this situation, to describe how your site plans to expense the remaining funds by the completion of the budget period, as well as justification for any projected unspent funds. So unspent funds may impact future award amounts. That'll be annually moving forward. You may see a change in your award amount based on your spending and historical spending. And so this is a way that if there's justification for unspent funding this year for a particular reason, you have the opportunity to document all that so that we can justify continuing to award you at your current amount. So that's a little bit of background on this item. We have clarified this. I think it said something general about unspent funds, but this is the protocol moving forward with this item and unspent funds. So any questions on that? Okay. And we'll always support you in figuring out ways to rebudget if you do have a staffing vacancy and that kind of thing, so that you can still be on target to fully spend your funding. All right. So, jumping ahead to page 6. Jump ahead to, okay. Just wanted to highlight under responsibilities of this McVie site. So providing office space, materials, and day-to-day supervision for their grant-funded employees while ensuring their deliberate coordination with the Children's Trust and the program manager. So this one, I wanted to reiterate, for Healthy Step sites, the way that you are meeting this responsibility is changing with the new program model. So the office space, materials, day-to-day supervision, all of that is changing, and this is where in the contract that we still hold you to the same standards as we did before, but the standards are different given the program model. Just wanted to point that out so that folks know. You can share this with other administrative staff at your site to just ensure that you continue to meet this responsibility, and that the folks that really are the ones signing the contract, the ones that are participating in this grant at their level, representing the organization as a whole, are providing you with the support that you need at the program level. So, all right, then this next one back to Deb.
All right, that's maintaining audit and similar reports for 3 years after the final federal financial report is submitted by Children's Trust for these funds. So this is basically, you need to keep all your records, finance records for this grant for 3 years after the final project period for that. The exception to that, where you may have to do that longer, is say we are being audited by these funds, and we would notify you that. Or if you're being audited for some reason and that audit is not complete, you would need to keep your records until that audit of those records is completed.
Does that answer your question, Sarah?
Now, I get about saving all the finance stuff, but what about like the consent that they were in the Healthy Steps program? I guess all the ASQs that we did would be scanned into the computer, the electronic EMR, but just some of the other things that we may have done, like the home screening stuff. How long do we have to keep that?
Theoretically, you're supposed to keep it 3 years past the life of the end of that fiscal year, if that makes sense.
Okay.
However, if you are tracking them electronically, that does count as saving those documents, as long as you can get to those documents within a 3-year period.
Okay. All right. Thank you.
Yeah, more than likely, I say this tongue in cheek, more than likely you're not going to be audited on programmatic concerns, in case management concerns, unless there's something egregious happens. But as a safety precaution to you and the agency, I would recommend to make sure that you keep them at least 3 years.
Okay, will do.
Then I have you on this one. Just a reiteration, Eric.
Oh, it's my turn. I'm sorry. Yeah. Well, we can under item O, confidentiality, safeguarding information. The second paragraph there, we were just going to point out again that it's a reiteration of the same deliverable that's in the list of deliverables from the previous pages. About the research component, the publications, information and materials. Again, if it's research and evaluation, make sure that it's vetted through us. If there's any data involved or any manuscripts that have intent to be published. Yeah, and I'll say my last comment.
All right, and then skipping to Q.
And well, I can start it off. Deb, if you want to finish up. This also speaks to that 3-year requirement, inspection and retention a little bit, but upon 48 hours, prior notice, Children's Trust or its duly authorized representative shall have the right to enter the site's premises. So we will give you 48 hours notice if we felt as though we needed to come in and if anything was caught as far, again, egregiously or anything along those lines. However, we always give you further notification for any site visits, things of that nature that are coming. But if there's anything that we need to audit as far as from a Children's Trust perspective, we will give you at least a 48-hour notice on that. Anything else further on that one?
No, that's about it. I mean, the exception there is says if we suspect criminal activity, we don't even have to give you a 48-hour notice. It's just that you have to grant us access to your records for the expenses that relate to the funding for this grant.
So, go ahead and jump ahead in your contract. Like I said, some of this legal stuff, it's all legal stuff, but some of the more legal stuff and less programmatic items we're going to skip over.
Yeah, I just wanted to say before we move on to the conditions and assurances, 2 quick things. One, a lot of the rest of the document is just legal jargon. However, I would make sure that the programmatic folks that are sub-recipients of funders, so for instance in Spartanburg, Clarissa, First Steps is our contracted entity. Make sure that you have a copy of this as well as a programmatic entity, as they will have to have that their responsibility lies in the contract, but you being a sub-recipient of them, you also are held accountable under these requirements as well.
Yes, I'm reviewing it, and Carolyn initialed it, and I have a copy of that.
Okay, sounds good. And then as we move forward into the conditions and assurances, again, a lot of this information that we'll be talking is a little more just detail about the things that we kind of said before. There's some things that are in addition. The one thing I did want to say, and I'm not sure if Kathy mentioned it at the beginning, one of the things that we're in the process of producing is a procedures and policy manual that will be a little more detailed about a lot of the deliverables in the contract. And we will be getting that out to you. So it's basically, it will be your manual of that you can refer back to a lot of the details that we're requiring in the contracts and programmatically. So hopefully we'll have that out before the end of this calendar year we're looking at. Yeah.
All right. So moving into the, it's a separate document kind of, because you have to sign it again, but the second part of the contract, the standard grant conditions and assurances contract. So just on this first, under number 1, federal, state laws, rules, and regulations, just want to reiterate that subrecipients shall comply with all federal, state rules and regulations appropriately, applicable and binding as it may be published in an official and legal manner. So things like the Americans with Disabilities Act. Just want to reiterate that there are things that you are bound to under federal funding, just given the funding. Nothing programmatic specifically here, really, just that you're receiving federal funding, and with that comes these other strings. So I want to reiterate that. And then at the end of this paragraph, highlighting this section here, nonprofit subrecipients must also adhere to the cost principles within OMB Circular A22, blah, 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 while educational institution subrecipients are subject to those OMB Circular A21. And in the last sentence, all subrecipients are subject to the provisions of 45 CFR Part 92 and the Uniform Guidance 2 CFR Part 200. So one of the things that I'm just not sure all the sites are clear on and all their financial folks are clear on, hopefully so, but I can be wrong. If I am, great. But this one, just make sure it is our responsibility to be fully aware of all the federal funding regulations under these CFR, I don't know what you call them, Uniform Guidance CFR stuff, but it is also the site's responsibility to keep in the know on what they need to be doing and what all the requirements are. So I just want to reiterate that, because we get a lot of questions sometimes as if we are the end-all, be-all of the interpretation of these requirements, and we are not. We are sort of in the same boat as the sites. We both have a responsibility to do our best to manage and meet the requirements of the funding. So I want to reiterate that, because like I said, want to make sure sites are aware that we are not the end-all, be-all of the answers to your questions on these items. Okay. Then, Deb McKenzie, anything to add there? Are we good?
No, I think that's good.
Okay. Real quickly on grant reports. So obviously the semi-annual reports, those are your progress reports. And then Deb's mentioned the RFPs due, and I think we really covered that already, so.
Right. Okay. What are you going? The only, where are we at? Right here. Yeah, about that. The reports being due by the, the 30th of the month following your period. That's fine. What else? I do want to just make note, I know you know these are federal funds. That's just very important that you track these all as federal funds. We give you the CFDA number because after you have a certain amount of federal money, your organization is required to have a single audit. So that's why it's very important that you track. And we do have to turn into the federal government a list of anybody we've given more than $25,000. That's kind of the way that they track to know which organizations as a whole are receiving, is it $375,000? I think it's increased to maybe $750,000 you get in federal money that you have to do a single audit. But anyway, that's the importance of doing that. And I think you all, and that's one of the things we check when we do our site visits to make sure you're tracking this as federal money. So that's just very important.
Okay. Cool.
Let me add one up thing also. Jennifer's on the call, correct? Jennifer Browder.
I'm about to hop off to get on this HRSA call, so if you have a question for me.
Yeah, real quick. I just wanted to reiterate at the end, our end of the year reporting is part of that does require to have timely data in the system. And you guys have been working through that over the last month or so. Jennifer, is there a specific date that you want us to add as far as that clause in the standard operating procedure moving forward?
I I think you could put the end of by the end of the reporting period, say like September 29th, September 3rd. This is for contract language for the, Beth just walked in the room.
Yeah, we'll put it, this actually go more, we can add it here, but it'll probably go into our policy procedures document.
Sure, that sounds good. And I'm hopping on this HV impact call now, so I'll talk to y'all later.
Okay, so jumping down then to number 4 on the conditions and assurances. I know we're right at time, so I'm going to try and speed this up. Highlighting this one. Funding for a salary, either full or partial, assumes the entire time paid by Children's Trust will be spent on the Children's Trust funded program or project. So no funds may be used to supplant salaries or any additional expenses. So if you are a stay-at-home visitor who happens to be a nurse, and you work in a pediatric setting, you cannot be pulled into nursing duties. You are a home visitor under the grant, and that is unallowable. So just to be clear, and all of your timesheets should document time you spent on the grant if you are partially funded. Otherwise, if you are, like I said, requesting funds that you cannot justify that you spent on the grant, then you are supplanting salaries, and that is a no-no. So, all right, that one's pretty straightforward. Then Mackenzie, do you want to reiterate the requirements on these?
Yeah, sure. And Deb kind of went over this a little bit earlier, but basically, if you have any variance in your budget of 10% or more in the personnel category, we'll need a budget revision for that, and 25% variance in the other categories. If you ever have a question on if you need to submit a budget revision, just please reach out to me, give me a call or email me, and we can discuss your situation. And generally, we like any personnel changes, anyone being added, taken off, to be reported to us. Small variances in the percentage of the personnel is okay, but we just like to know if anyone's added or removed.
All right. So I think that's pretty much everything we wanted to touch on. There are a few more things like background checks done annually. Make sure you read through the conditions and assurances as well as the contract, and everything in here is pretty self-explanatory from this point on. So any questions about anything we shared or any deliverables that you need further clarification on?
Okay, this is going to sound stupid, but do I need a background check yearly? I mean, I don't see the kids. I haven't been doing that.
If you, what does it say? Direct care, treatment, or custodial responsibilities for a child. So if you are serving families, then you need one annually.
All right, but I don't think, since I'm not really doing anything with the families, I'd be okay. It's just kind of like the lead person on the grant, right?
Yes.
Okay.
Yeah, and if your supervisor was mostly supervising, but then seeing families as well, a small caseload, then yeah, anybody who's doing that needs one.
Thank you.
You're welcome. All right. Okay, well, any other questions? I'll just pull our PowerPoint back up real quick if it'll share. No, it won't. Anyway, just to clarify at the end of this webinar, any questions you have related to anything we've shared, you can contact any one of us, and I'll send out our contact information on a PowerPoint slide so you have it in that format. But also, for Parents of Teachers site, Amber is your contact, as well as Mackenzie. For everybody else, NFC, HFA, it is me, it's Kathy, as well as Mackenzie for the financial side of things. And then you can reach out to Deb and Eric as you like on any questions you may have, especially folks that you've been around a while, everyone's expertise. So we're all here to support you, but there are main points of contact, and I wanted to reiterate for certain sites moving forward, it's between Amber and I. We've kind of delegated that. So, all right. Well, thank you guys for being on. I'll send out the recording of this so that if you want to share it with anybody at your organization, you may. But I appreciate all your time. Okay. Have a good rest of your week.
Thanks, you too.
Thank you.
Thank you. Thank you, Kathy.
Thank you.